Do we need to start over? Okay, that's all right. Good evening and welcome to the McHenry County Board of Health regular meeting for January 12th, 2026. Calling the meeting to order at 6:32 p.m. We'll begin with a roll call, please.
Ms. Althoff?
Here.
Dr. Amsler?
Here.
Ms. Carmen?
Here.
Ms. Hollyfield?
Here.
Mr. Clark?
Here.
Ms. Gaffney?
Here.
Dr. Katz?
Here.
Ms. Lawson?
Here.
Dr. McGuire?
Here.
Mr. Markison?
Here.
Ms. Ortiz?
Here.
Dr. Zurich?
There are sufficient members to complete a quorum and conduct business. Item 2 on the agenda is public comment. Anybody here for public comment? No comment from the public. Move on to item 3, approval of minutes from the regular board meeting November 17th, 2025.
I make a motion to approve the minutes from the November 17, 2025 meeting.
I'll second it.
Any questions or comments in regards to the minutes? Hearing seeing none, motion's been made by Ms. Carmen, second by Ms. Holyfield to approve the minutes from the regular board meeting November 17th. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it, motion passed. Item 4 is employee recognition. Tonight we are recognizing Lisa Shack from the Administration Division for 5 years of service to the county. And we are very appreciative of her continued efforts and say thank you.
Yes, so I have a couple of things and then, so Lisa is newly in health administration. She has previously worked, she started in the public health nursing division and then she moved to community health when we did the division split. So she has been here 5 years. She's participated in our succession planning, has really been instrumental in working with budgets and grants. So she had the experience to move over and up into this position. And so she's been with us since about August. And she's been a huge help. She's jumping right in. We're happy to have her on our fiscal team. She's doing a great job.
So she started during COVID in 2021, so we were kind of complete chaos at that time. And she came in and she brought organization, attention to detail. Like her follow through is amazing. Her leadership skills are great. She's currently running our 60th anniversary committee.
Oh, I had it on my list to say. I forgot to say it.
I was gonna say it.
I mean, I'm happy for her that she found the opportunity in admin, but we really do miss her. So.
Well, you can't have her back.
Well, thank you, Lisa, and a round of applause for her, please.
And she missed the $1,000 check because she wasn't here, right?
The county administrator.
Okay, item 5 is department and division updates. Administrator Patterson.
Okay, I have a number of things. So first off, Dr. McGuire, has graciously been filling in her pseudo vacancy while we've been looking for a replacement. So we do have a candidate that was recommended at the Public Health and Community Services Committee. Hopefully you will remember him. His name is Dr. Irfan Hafiz. He was our TB director for many, many years. And so he expressed interest. I reached out and it will go, I am confident that he will be appointed. There's just a question of the length of time because we've gotten off of our appointment cycles a little bit. So both physician appointments are on the same schedule. So it's unclear if he's going to fill out Dr. McGuire's remaining term and then be reappointed or just be appointed to a 3-year term. So I'll provide more information. We're waiting on a state's attorney opinion for that. And does anybody have any questions about that? So this could be Dr. McGuire's last meeting.
Are we full, otherwise we have 12?
Yes, we have 12 members.
We're gonna find a way to keep him.
And if it turns out that he starts in the summer, I can still do as I'm able, if it's okay. I don't mind coming through the,
No.
I only worry about quorum or having to have a physician on the board, so I don't wanna like leave you guys hanging.
And thank you, we appreciate
A
that.
second physician, we
Second.
have a physician, you and I met like, anyway.
I didn't know. I didn't know that this was our last time.
He's only 41.
What kind of lieutenant?
I would have brought it. He had off the whole break. Break my heart.
So they should have brought you. Okay.
Yeah.
Like you probably don't.
You know, actually, this is the firehouse. The person who we're celebrating brings the cake, not the other way around. It's kindergarten rules.
Okay. Okay. Other things, and then I'll get into it. So I don't know if I mentioned this before, but I am participating on the technical advisory group for the McHenry County Conservation District for their Forward 2040 plan. So it is intended to be a plan that's going to map the next 10 years and identify needs of the community and help guide the district's future initiatives. They also have other stakeholder meetings, and we have some other staff who are going to participate in that. So we have our first meeting this coming Friday, so as I have more information, I will share that. Then you've probably, if you're paying any attention to the news, there's been changes. The ACA subsidy extension did pass in the House last week, so now it goes to the Senate. It's very unclear if it's going to pass or if they will negotiate something to move forward. And whether or not it gets vetoed when it goes to the president's desk is also unclear. There is still that hanging thing out there, that continuing resolution to keep the government funded. That expires as of 1/31/26. So again, don't know what that's going to look like yet. Other changes that have been implemented are the vaccine schedule. And fortunately, in Illinois, our governor signed into law back in December to create some safeguards for the vaccine recommendation process. I think I mentioned before that they've had established this Illinois Immunization Advisory Committee. So the law puts into place the membership makeup, the composition and the total numbers, as well as gives the authority to the IDPH director to formally issue statewide vaccine guidance. And as of now, IDPH is going to endorse the August 7th of 2025 CDC routine vaccine schedule. So that's prior to a lot of the changes, and also maintain the universal Hep B dose recommendation. And if you are interested, I can share more additional details. Essentially, the science hasn't changed. That's one of the arguments, on the pro-vaccine side, is that really the science has not changed despite these recommendations. So if you're interested, I will forward some additional information. The other thing that changed were the dietary guidelines that were just announced. So they're describing it as they've flipped the pyramid. IDPH is going to be monitoring the changes in those recommendations, and I don't know if they'll be putting out different recommendations. We don't know what other impacts that will have at this time. And then Ann is not here, so I'll give you an update, or does anybody have any questions about that?
I'll just add on to that too, that Illinois actually just today, or it was on Friday, extended in the state of Illinois the amount of time for subsidies. So people here in Illinois do have a little bit of a breather room to see what happens. So that was done as well.
Yeah, and I think there was some funding available, and depending on that funding might extend those a little bit longer.
And Aetna nationally came out and said they will, because I work for Aetna, we got email from saying that they will pay nationally for all childhood immunizations if they're ordered by a physician.
Yeah, and that's part of the law too, that whatever the IDPH and the advisory committee recommend, that there is a insurance impact, that those will be remain covered.
I mean, large part of that was the most financially literate business decision one of these companies could make, because they're trying to avoid long-term
Right, yeah.
cost. Fortunately, that's, still a very powerful driving factor.
You mentioned that it has to be prescribed by a physician.
Well, it just said that they will pay, I mean, I didn't read it, I can't remember, it was like last week, but they're basically saying they're gonna pay for all the immunizations. They're not gonna go by this guideline stating the CDC is saying that they don't need them. They're like, I think it exactly said what they're following the guidelines with the American Academy of Pediatrics, that they're recommending these immunizations, they will be paid for, yeah.
Do we have provisions
Is how this day goes.
if there is a party that can't afford private healthcare, can't afford to go to a family physician for a prescription for the vaccines? Is there a public sector physician that could
We have the Illinois vaccine.
For adult.
We have a program for adults and a program for children vaccine. For children program with the VFC, so children who are uninsured or underinsured can get vaccines as well as adults who are uninsured or underinsured. It gets a little bit more complicated than that, but just surface level, yes.
okay.
And then sliding fee scales, and the federally qualified health centers would be another access point.
So there are some primary care offices that serve youth that do not also give them the vaccines, if that makes sense. So like they would see them, but then they would come to us for their vaccine.
That's what I was looking for.
Yes.
Thank you.
Is it necessary to have a physician's prescription for, I think most
No, but you
vaccines,
can go
you
to the,
could walk into almost seems like you go to the gas station nowadays for one.
Sure, I mean, like the current
Jewel.
CDC guideline is that like a lot of these
Walgreens.
vaccines
CVS.
are by discussion with physician or
Right.
physician.
based on shared clinical
Yes,
decision
yes,
making.
the shared clinical decision making would be the direct quote, so.
Yeah, and those primarily, so they did remove several vaccines, rotavirus, COVID-19, influenza, hepatitis A, hepatitis B, and then meningococcal.
It's insane.
I know.
But those are all under shared clinical decision making, but the state of Illinois is keeping them on that schedule, the previous routine schedule. So I'm sure there's gonna be more.
Never seen a kid.
You haven't?
No, I'm just saying, I feel like that's what's going, it's like,
Oh,
Yeah.
yeah, it has to be important trials.
yeah.
Let me go ahead and move into it.
Yes.
Okay, so in terms of health admin updates, so the Crystal Lake construction, the new cubicles and furniture has been installed on the clinic side, so it's starting to look like a real office again. And the demolition is completed on the animal control side. The final HVAC unit is going to be installed on the roof this week, and ductwork will be completed. Animal control is still fully operational. You can see that on a lot of the county signs to remind people that we are open. So the administrative side has moved over to the clinical side, so the public can come in there. And it's expected to be completed in mid-March, all of the construction. So then there's going to be a ribbon cutting ceremony held on April 10th from 9 to 11. There's going to be refreshments, a video album, and recognition of public health heroes, among other events, and will be part of the morning as part of our 60th anniversary celebration. And then also, we're planning on celebrating staff and finalizing a venue, so we're doing another all-staff meeting with a team training. And so we'll have more information to come on that. And then also as part of strategic planning, we are restarting a QI committee. It's being led by Deb and Ann so far, and will be involving staff who will assist us in determining efficiencies in all the divisions. That is.
QI stands for?
Oh, quality improvement, sorry.
Okay.
Do you want to talk about the donuts
The
or?
donuts, let's talk about the donuts. Yes.
fits in nicely with the nutritional guidelines.
Wait, did they make it at the top of the list? Can I just eat
No,
donuts?
donuts are not at the top.
Well, it was a big discussion on what kind of treats to have at the ribbon cutting, and we decided donuts might be the best way to go. And if I've got this right, we were gonna ask if all of us wanted to each donate a dozen donuts for the event. Did I get that right, Cindy? Okay,
Sounds good.
so
I'm in.
we take a vote.
Want me to check them out?
I don't, it's not new business, it's not technically new business.
Who's
Well, what
collecting?
does it fall under?
So,
Who's collecting?
Who's collecting that? I wanna go buy donuts and bring them out.
Just
so I think what we can do,
Send it to me and I'll go bring them.
we'll get them through Country Donuts, and sometimes they give us, if we let them know the night before, we can pick a bunch up for free. They'll donate them, so we'll see what they have on, and then buy whatever else we need.
You know me on a first name basis.
Okay, so then we'll leave that to you.
So maybe
Just so everybody knows, this is the most important issue of the night.
I thought
Okay, I thought this was like a joke.
No.
I couldn't monitor my face.
What is
It's
donut
easy.
in
Donuts.
April 10th.
Donuts.
Can the
But we were
donuts also
talking
be
cupcakes.
donut holes?
Eloise is
selling Girl Scout cookies if we want to have Girl Scout cookies there.
We were talking about cupcakes and things like that, then it got really
Yeah.
expensive, so.
It was, and cutting up a cake and
Yeah,
serving the
doing all that
cake and all.
So Kyle, if you could take that on, we will have our committee meeting coming up.
Donut holes too.
Sorry, I'm working that day.
I can do it, I can do it. If you can go in and help order, I can go pick up cheese.
Yeah, and then just,
April 10th?
and just see if they're willing to do it like the night before, we can get them for it, because it's a morning thing.
That's what we thought, donuts
they
would be
can,
nice.
if they wanted to donate any leftover donuts, at the end of the day donuts.
10 o'clock, I thought you said.
Did you say 10 or did I say 9?
We were asking the board,
Girl
just
Scout
in case
cookies.
they don't have a lot to donate, you might go in there, we only have like a dozen.
Yeah,
We need a
9 to
backup plan.
So it would be early morning.
Yeah, early morning.
We're talking about.
And it's close by animal control.
Yeah, that's right. So that's all.
Okay, very good. Director Noel?
Oh, thank you. As of January 1st, Environmental Health is piloting just a program to go cashless for the department. It's been part of some discussions that we had over the past, I'd say 6 months or so. So we felt we could do it since we have so many online applications and things like that without any difficulty. So we have no issues so far. We're working with Webmaster to increase our online payment options and also to make those more user-friendly moving forward. I've been working with the EPI team actually for several months also to implement some performance measures specific to the food protection program. So we're looking at, well, actually they're doing all the hard work, looking at all the available data since we have years of food inspection data. And we're going to use that for employee QC, trends in inspection data, identify areas where we need to concentrate and do additional training for our food establishments, et cetera. It's going to be kind of a cool thing. It'll be updated quarterly and available online. So it's going to be a nice thing. And then we're really just working on our preparation for our program reviews that we have this year. So we'll be reviewed in food protection, private sewage, potable water, recertification in our lab, and accreditation with the IEPA. So working on some things to make sure that those go smoothly. That's it.
Questions from the board? On the cashless payment,
Yes.
what are the options for a citizen?
So it's really cash or card. I mean, no, it's not. It's check or card. It'd be a check or card.
A credit card?
Yes, and we do, yes, a credit card, and we do invoice people too. So if people couldn't do it, we don't, it's not our intention to deny service, but we can invoice people as well.
It's brilliant because, we don't have pennies anymore. Just saying.
I got that question, to see if that was the impetus for it, which it wasn't, but it's gonna be a plus.
So,
If they use credit card or debit card, is there a
3%
Yes,
fee?
there is the processing fee it's really, that all of us in the government center have to, abide by. So there is a small fee for that. So they'll have that option if they want to just submit a check instead and avoid that fee. But I would just tell you, food establishments, et cetera, we get so many online or credit card payments now, just for the simplicity of it. Most people don't really, are not too concerned about that small service fee.
Thank you.
so there is no way for them to pay cash?
Correct.
Do we run into any issues there where, you know, like legal tender? You know, like somebody comes to you and they say, I want to pay this, here's my cash. How can we refuse it? I'm assuming the state's attorney's office signed off on all this?
Well, I'm gonna say, planning and development has been cashless, and they do similar types of permitting and everything for several years at least, and so that's not been an issue for them either. But it's, like I said, it's not our intention to deny anyone service that didn't have it. We could invoice someone, you know, we're not gonna not accept a water sample if they can't give us that payment, you know, via check that day. So I don't think we'll have any issues, but we're willing to kind of work through those and see how best to address it.
I'm just curious, what other, I would like you to consider the possibility that someone might not have a checking account or a credit card. And truthfully, my experience with this has been like the least fortunate, the most vulnerable of our population. So like, just personally experienced, my father runs a insurance business out in the Quad Cities. And he gets a ton of people that come in and they just pay cash. I'm just like, and that's mind blowing to me. But then they get, every company out there will nail them and then make them pay extra. And they don't have checking accounts, they don't have credit cards, but they have to have insurance on their car to drive, so. I worry about that.
Well, and we understand that. I mean, I would say we've had people in the past, you know, bring in money orders and things like that. And people can, you know, obtain a money order for, if they need to, things. I just don't think we're gonna have a problem, but we're not gonna deny someone service. We'll work through those. And I can certainly report back, you know, to let you know how it's going, to see if we've had any of those issues and how we address them.
Yeah, I imagine they would just say, oh, you don't take cash? Well, I don't get cash, so I guess I'm not getting my water tested. Or,
You should call Kyle, they can pay him cash, and then he can pay.
I would do it, but I think the intermediary there is is there somewhere else in the county that uses like the treasurer?
The treasurer takes cash, but I don't know if the treasurer would be set up at
Right.
time of service to, you know, they're gonna have to walk out of the treasurer's office. I think the money order is probably the best solution to the challenge that you bring up, because you can't obtain it with cash, and that would satisfy an additional step on the clients. But their department and their team aren't set up to take cash or make change or anything like that, so we have those challenges.
Money order costs money though, right? I know, I recognize that, but.
Would you like to introduce yourself?
When the time's right.
I would like him to introduce himself.
I think the time's right after that very knowledgeable comment.
I looked right at him, I'm like, I know, and he answered the question.
Well, is the time's right?
Sure, please.
Hey, my name is Scott Hartman. I am pleased to announce I am the new McHenry County Administrator. I succeeded Peter Austin as he retired on January 2nd. And many of you already know me. I've been with the county for 11.5 years as Deputy County Administrator, so hopefully it's a very seamless transition.
Well, congratulations.
Thank you.
Thank you for being here.
Thank you.
I had a
Thank you.
follow-up question on that.
Sure.
The Angelo thing, did that get sorted out, the plumbing issue?
Drawing a blank.
Not round the clock, that's what I meant.
Oh, yes.
Okay.
Yes.
Thank you.
There's just been a little bit of discussion about electronic payment, like Zelle or Venmo or Apple Pay. Is that something that's going to be worked on for the future?
Well, I think that's really more of a county system question than it is really just for the health department. You know, currently, it's just regular credit card payments through a reader at the counter.
Still need a bank account for that, though.
Right. And online payments with credit card.
So there's a whole generation coming up that has no idea how to write a check.
They don't even get checks.
They don't know how to dial a
They didn't
phone.
have them.
Oh, they don't.
I have a colleague, she's like 28, and she doesn't have checks. She can go to the bank and get 5 at a time.
Correct.
They don't.
Order them through
And everything is done by phone payment.
Yeah.
Transfer money. So that's the future. That's something we need to work on.
Sure.
Yeah.
We understand.
An additional option, that might actually solve it better, was someone in that case, I know Walmart offers that, where you can go and you can pay cash and load onto a prepaid card, like a debit card or something like that. And that wouldn't cost, I don't think that costs anything else.
You can just add a QR code and then people can scan it and pay.
Well, I will ask our webmaster.
There you go.
Thank you.
Good.
Sorry, didn't mean to pummel you with
No,
that.
I appreciate it.
You did know. You meant to.
I wasn't alone in this, okay? There was a whole row of people.
Director Howell?
Yeah, I'll just kind of go over what Patty was just talking about. You know, we worked with the auditors, and worked with the treasurer's office to find out about how to do some cashless for us because we do all of our drive-through clinics. So at some point in time, we're talking about getting, I don't remember what they're called, that go into your phone.
Square.
Yeah, right.
Which I think you could do the Apple Pay and such through those squares.
You don't wanna use those
They
anymore.
ding you, though.
You wanna just use the handheld
Well,
little thing.
We'll get,
The newest technology of how
yeah,
you can do
we'll
it.
get whatever technology
Yeah.
they think that we should be using. We're not there yet, because we do have people who sometimes, as the animal control administrator, I say, go out to your car, look through your car and see how much change you have, right?
Yeah.
Because if we need to get the animal back to someone, we want to be able to do that whatever way we can do that, if they're showing the need for that. So we probably be introducing some more cashless, but we still have that issue where somebody shows up with whatever they have. So I just thought I'd mention that to you. We are working through some of that for our drive-throughs, but we're not quite there yet. We were able to just start allowing volunteers to come and walk animals and socialize cats on Sundays. So with our new system, we had to go and get some volunteer badges that would work just on Sundays so that people could come in. They still have to text or email a person in the office to come out to let them in the first time, but now we're able to do that. So if anybody you know who wants to volunteer and they've been told they can't come on Sundays, we have that opportunity now. We have a few people coming on Sundays. I meant to tell you this before and I didn't get around to it. So we work very closely with the Illinois Department of Agriculture. They oversee the Animal Control Act. Part of the Animal Control Act is that responsibility to do a rabies observation if the animal bites. And it's a 10-day observation period. Well, since COVID, there has been more and more issues with finding veterinarians who can do that hospital confinement, getting appointments in a timely manner. An animal might bite on Sunday and then they're not going until Thursday. So we had a good talk with the Department of Agriculture and it's pretty much been decided, or really it already was in existence, but we weren't following this parameter, is that a rabies observation really starts within 24 hours of the bite. So now, if you have an animal that bites on a Sunday, we're counting 10 days from Sunday. That said, there are a couple of veterinarians, because the rabies observation, right, is done by a veterinarian who's licensed. So we have a couple of veterinarians who are uncomfortable doing 10 days from the bite. So that is their prerogative because the rabies observation is written off of their licensing. But I would say 95% of the veterinary offices have sort of embraced it because other counties have done that. More and more counties in this area are doing the 10 days from the bite. So I wanted to make sure you were aware of that. We pushed all of our information out to our veterinarians in December for the new year, but I'm sure some questions are going to come up here and there about it.
Does that change those parameters if the dog or cat has not been rabies vaccinated?
Well, if an animal's not rabies vaccinated, they're supposed to do hospital confinement.
Okay.
If they are vaccinated, which means they have to have received their vaccination 10 days before the bite to be considered fully vaccinated, then they can do home confinement. We do have more and more people who are asking for different reasons to do home confinement instead of hospital confinement. One of those being, one, the economics of doing hospital confinement. Two, they feel their animal either has medical situation or anxiety that it's hard for them to do the hospital confinement. And I think we might find more people who are getting it done and getting it done for what's the required period by cutting it back to from the bite. So we're not really cutting off the 10 days, we're just doing it as the state has said is more than suitable from the day of the bite.
And that's initially issued by the attending physician though, correct, the bite? Because they're not going to self-report unless...
They do self-report.
I mean, they do self-report, but it's
We would go by the medical facility. If we had a document that came from medical facility, we would go by whatever date is on that medical document that the person has reported to them, right, to fill out that document. So, the other is, this is our time of year. We have a bunch of licensing and certifications coming up. We just did our DEA license, so I don't know if you're aware, when you have a controlled substance, you also have to have the DEA license, and then you have to have the state license. So we have a couple different licenses in our system. We have Dr. Kennedy's license that we use for any prescribed medications outside of those couple of controlled substances that we use for euthanasia. And then we have our controlled substance agency license, which we use to be able to purchase those controlled substances for euthanasias. We just finished our IDNR. We have an IDNR license that says that we can work with wildlife. If you don't have that IDNR license, you cannot take in wildlife. We cannot keep wildlife at our facility, but we can bring wildlife in and we can move it out to the appropriate agency. And then the last is, we're coming up on our euthanasia certificates. So in April, all of our licenses end, and we have to get all of our documentation and payments done for that. And that does include taking a few, you have to have had some continuing education classes to be able to get your license renewed. So we're working on getting everybody through those. It really is about compassion fatigue and learning how to work through when you have to euthanize the animal. It can be very emotional. And then I guess I was just going to talk about the fact that we're working out of the clinic side. It's going fine. It's going fine. Doesn't seem, the public seems to understand where to come in now. They're getting their services done, and that we don't seem to be having any problems.
Who's ever doing the posting for the Facebook page? That's doing a great job.
Oh, good.
I actually need to stop following that on social media because I have to stop following that on social media because when it pops up, I was like, oh my gosh.
I know sometimes it's...
People in my house are very allergic, but...
Do you need a few?
I know.
Any further feedback on the rabies the rabies dog? Any more fallout from that? The one that came up from...
The one out of Chicago?
Out of Chicago.
Yeah, but it came from Georgia to Chicago.
Not any more that I'm aware of. You know, we have been talking with the Department of Agriculture about just tightening up some of those parameters about bringing animals from out of state, bringing animals from down south of state into the north of state, and what should be some of the parameters, so that we are making sure that as best we can, animals are not coming in with different types of
We still only have one inspector in this area that has to look at the health certificates for animals coming in from out of state. Because a lot of shelters take them in from out of state, and it's not the county's responsibility.
It's not the county's responsibility, but if we were to have a situation, I sure would want to look at those and have Dr. Kennedy review them.
Cool, thanks.
Any further questions from the board? Thank you. Director Heck?
Just have a couple updates. So a lot of our programs will be attending the People in Need conference at the end of the month at MCC. So if any of you are interested in that, it's a great event. We participated with in an ER weather emergency tabletop with EMA with many departments in the county, and that was, I think, a really good experience for all of us to be at the same table and talk about the issues. So. And then the last thing is just Bridget Hoffman is our emergency response and preparedness coordinator, and she was selected to participate in the Region 5 Public Health Institute that's overseen by the University of Michigan. So she'll be doing that for the next 6 months.
Questions from the board? Okay, thank you. Director Durrett?
Sure. I'm proud to say that we are as close to fully staffed as we have been since I took this position, which is really exciting. We hired a couple of new nurses. In the budget cycle, we had combined some FTEs to create some positions. We're working on doing more team collaboration and cross-training for our clinical services, creating more overlap, and in preparing for spring and summer outreach events. So we're excited about that, and I'm currently working on training. January is Cervical Cancer Awareness Month. So IBCCP is taking the lead on putting out some media and having some discussions about that. We have a quarterly Women's Coalition meeting that is happening this Thursday, and our STI team is going to present on HPV and the Gardasil vaccination, which I would point out is administered to men and women up to age 40. So something for people to keep in mind that still it was not readily available for men specifically, but also for those that wasn't available when it first came out, say in 2006, they could still get that vaccination within the guidance of their physician. So we're just bringing some awareness to that. Our IBCCP team has been very busy, and fortunately or unfortunately, we've had an abnormally high number of diagnostics. We've had 8 biopsies since July, with another 4 pending. 1 cervical cancer diagnosis, 4 breast cancer diagnoses, and we are waiting biopsy results for more. We have a Referral for Treatment Act, so the TTA, it's basically fast-tracked for Medicaid. So in addition to the numbers that I just gave you, we had another invasive cervical cancer and 3 additional breast cancer diagnoses, in which those women were all referred through to care. So very, I think, heartwarming to know that we're doing that work and making a difference in those women's lives. And I'll try and bring forward some feedback further that I kind of shared with you before, just about the difference that they're making and the feedback that they're getting for these women who are extraordinarily grateful that they've had the assistance that they did to get the treatment that they needed. So I guess you may or may not have heard that it is a rough influenza season, so I'll kind of touch on our communicable disease team. They've been very busy at managing outbreaks, monitoring case numbers, transmission, and spread, and providing education to mitigate additional spread. What's positive is that the case numbers have been remaining low within each of our outbreaks, but we have obviously seen an increase in the number of outbreaks. That is to be expected for this time of year. However, I would say that influenza levels are higher than they were last year, which was also increased from the year prior to that. We're monitoring them closely, but visits to the emergency department and the inpatient admissions are up locally and at high levels, as they are across the state. So this could be, or is likely, a more severe season than what we had in prior years. The inpatient side for influenza, especially for age 65 and up, is increased, really higher transmission among all age groups. COVID still remains at high transmission levels. So like I said, we're monitoring. Messaging has gone out to our school systems and to our long-term care facilities, specifically regarding influenza. We kind of touched on norovirus with the schools, and just things to do to mitigate. Keep in mind, encourage families to stay home if they're sick and to mitigate transmission. We do have grant dollars that we've reached out to local long-term care facilities as well as other entities to talk about whether or not they need COVID, influenza A, influenza B test kits. So we're trying to get the word out that we have that maybe available, or to reach out and see if there's other ways that we could help them or support them in this season, especially considering how high the respiratory, like influenza numbers are this year, what we could do to help them mitigate that, if it's education, if it's PPE, if it's more test kits. So we've been busy.
Very good.
That's all I've got.
Questions from the board?
I heard briefly about this variant, the Super K. Is that right, or am I? For influenza.
I don't know, I
it's like
haven't heard specifically the variant, but influenza A is normal for this time of year. The influenza A levels are high. I would say, like, based on the numbers, I just can't say yet that it's perhaps more virulent than previous years. Like I said, we're monitoring the numbers, so all I can say is it's definitely more severe than it's been in the last 2 years. I don't know that I can speak specifically to the.
Okay, I wasn't sure if I didn't catch the whole thing, and that was the problem, but it was talking about how an additional variant had been identified after they'd already decided on which ones to include in the yearly vaccination.
That is true.
Yes,
that is true.
It is, okay. And that the vaccines were still conferring a lot of protection, but that they were still seeing this, whatever, I don't know, so There is is it part of A? Is it,
It's part of A.
okay, it's like a subtype
A is
of
the one
that
that
family?
mutates more easily and frequently.
We usually
Hold on
see
a
a
second.
spike in A and then a subsequent spike in B, so we're in this spike of A.
Hmm.
I don't know if that, like, if that helps, but yes,
But
They
we're
might
not
have
at
missed
some
the most
crisis
likely
level
vaccination this year.
right now, where it's high, but not like crazy.
We're monitoring levels. I'll keep you posted.
Dr. Amsler?
Measles,
Uh,
that's been recently an outbreak in Chicago area.
We have not had any issues with measles here as of yet.
No,
No.
no
Which is positive. We did a measles workup previously in preparation for the event if that were to happen. But no, thankfully that has not yet been an issue here. We'll be hopeful it stays that way.
Yeah.
Ms. Althoff, did you have a question? Okay. Thank you. John?
Thank you.
Okay, that's it for department and division updates. Does any board member wish to have an item removed from the consent agenda? Hearing seeing none, we will move on to the consent agenda. Dr. Amsler?
I would move to accept the consent agenda.
I'll second it.
Motion has been made by Dr. Amsler to approve the consent agenda, seconded by Ms. Holyfield. Any questions or comments from the board? All good? As it's a monetary item, we will do a roll call vote.
Okay. Dr. Amsler?
Yes.
Ms. Hollyfield?
Yes.
Ms. Lawson?
Yes.
Dr. McGuire?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
Ms. Gaffney?
Yes.
Ms. Altough?
Yes.
Mr. Markison?
Yes.
Ms. Carmen?
Yes.
And Mr. Clark?
Yes. All voted in favor, motion passes. Item 7 on the agenda, contracts and agreements, new. First one is 7A, a memorandum of understanding from with the Huntley Community School District 158. Does any staff member wish to speak on this?
This is an MOU that we have with Huntley Community School District to do wellness screenings at one of their health fairs. So they're having a health fair for staff, families, and residents. So we're gonna bring the mobile clinic out there. Yep. So there is an error on the date on the first page. That's my fault, sorry. I was typing at the beginning of the year. So we have corrected that, so Melissa does have the corrected version of 2026. Sorry.
You caught it. That's good.
Make a motion to approve the Huntley Community School District letter of agreement.
I second.
Motion's been made by Ms. Gaffney, seconded by Ms. Ortiz, to approve the memorandum of understanding with Huntley Community School District 158. Any questions, comments from the board? As there does not appear to be any additional money expense with this, we will have a voice vote. All those in favor say aye.
Aye.
Opposed, say nay. Ayes have it. Motion passed. Next one is 7B, memorandum of understanding with the Crystal Lake Public Library.
We're gonna hear a lot from the high school, sorry. This is our, we're bringing the mobile clinic out to the Crystal Lake Public Library to try our first go at WIC on the go, so we'll see how it goes. We will move out to Harvard and areas like that, but right now, because Crystal Lake has closed our building, we're trying to get in that area to kind of serve the people that are used to going to Crystal Lake. So hopefully it will all go well, I think we're all ready.
Make a motion to approve the memorandum of understanding between the Health Department and the Crystal Lake Public Library.
Second.
Motion's been made by Mr. Markison, second by Ms. Gaffney, to approve the memorandum of understanding with Crystal Lake Public Library. Again, there's no money impact on this, so we'll do a voice vote. All those in favor say aye.
Aye.
Opposed say nay. Ayes have it. Motion passes. Item 7C, memorandum of understanding with the Community Action Agency for Head Start.
So this is another MOU that's required by our WIC grant and is also required by Head Start. So to do a joint MOU, to be able to refer to each other for services, so, and then partner with each other on things, so.
I will make a motion to approve the Community Action Agency for Head Start MOU.
I'll second it.
The motion has been made by Dr. Katz, seconded by Ms. Holdenfield, to approve the memorandum of understanding with the Community Action Agency for Head Start. Any questions or comments from the board? There does not appear to be any financial impact, so we will do another voice vote. All those in favor say aye.
Aye.
Opposed say nay. Ayes carry, and the motion passes. 7D, memorandum of understanding with Woodstock Public Library.
So this one is to have wellness screenings at the Woodstock Public Library once a month. So we will be bringing the mobile clinic out there.
I'll make a motion to approve the MOU with Woodstock Public Library.
A second.
Who second? Dr. Amsler? Okay. Motion's been made by Mr. Murkison, seconded by Dr. Amsler to approve the memorandum of understanding with Woodstock Public Library. Any questions, comments from the board? Hearing, seeing none. We'll do a voice vote. All those in favor say aye.
Aye.
Opposed say nay. Ayes have it. Okay, the next one is a grant agreement with Illinois Vaccine Access Program. This is 7E on the agenda.
So this is to support equitable access to vaccinations within McHenry County. It's really doing what we're already doing. We do VFC, Vaccines for Children, the program. We already give vaccines to youth. This particular initiative is supposed to help improve access to respiratory virus vaccines specifically for children under 3, because there are other entities that aren't giving those otherwise. So we're trying to fill a gap. As I said, it was a natural thing for us to take this on because we are already doing what they're asking us to do. It's a $25,000 grant, which we're using to offset a portion of salary and fringe from the general fund.
Bear with me, there's a resolution with this that we are asking the county board to approve. I'm going to read it so it's in the record. Resolution requiring supermajority. Resolution authorizing the emergency appropriation of $25,000 in vaccine access program grant funds to the Department of Health for fiscal year 2026 budget. Budget category item number 51. Whereas the McHenry County Department of Health has been notified by the Illinois Department of Public Health of a grant awarded for the Illinois Vaccine Access Program, and whereas the IVAP supports equitable access to vaccinations across Illinois with particular emphasis on improving access to respiratory virus vaccines for children under 3 years of age through vaccination clinics, coordinating with local providers and ensuring compliance with IDPH guidance, standing orders, and data reporting requirements, and whereas the additional monies help support McHenry County Department of Health's existing immunization clinics and outreach efforts, ensuring anyone who chooses to be vaccinated has the opportunity to do so, and whereas this additional grant funding was not included in the fiscal year 2026 budget and requires the approval of the McHenry County Board to appropriate the funds, and whereas the resolution has been reviewed by the Board of Health, Public Health and Community Services, and Finance and Audit Committees, and is being recommended to the County Board for approval. Now therefore be it resolved that the appropriations in the amount of $25,000 in grant funding is authorized in the Department of Health fiscal year 2026 budget as follows. Revenue is $25,000. Expenditures for personnel is $21,788.01. FICA, $1,666.78. IMRF, $1,545.21. Be it further resolved that the county clerk is hereby authorized to distribute a certified copy of this resolution to the county auditor, county treasurer, director of human resources, chief financial officer, county administrator, and the public health administrator. and this will be dated on the 20th day of January in 2026.
Can I make a motion to approve the grant agreement for the Illinois Vaccine Access Program?
Second.
Second.
I kind of want to hear it again.
I know.
The motion has been made by Dr. McGuire, seconded by Dr. Amsler, to approve the grant agreement with the Illinois Vaccine Access Program, as this does have a monetary impact. We'll do a roll call vote, please.
Dr. McGuire?
Yes.
Dr. Hanson?
Yes.
Mr. Markison?
Yes.
Ms. Holyfield?
Yes.
Ms. Altough?
Yes.
Ms. Gaffney?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
Ms. Carmen?
Yes.
Ms. Lawson?
Yes.
Mr. Clark?
Yes. All voted in favor, motion passes. Next item on the agenda is new and unfinished business. Item 8A is a resolution establishing remuneration and authorizing a monthly stipend for McHenry County Board of Health members. Item 51 in the budget category. I'm going to read the resolution and then open it for some discussion. A resolution requiring a supermajority of the county board. Resolution establishing remuneration and authorizing a monthly stipend for McHenry County Board of Health members. Whereas the Illinois compiled statutes, Chapter 55, Section 5, County Codes, establish monthly compensation parameters for the Board of Health as remuneration for their services as members of the Board of Health, and states amounts shall not exceed $200, except in the case of the Board President of Health, whose monthly compensation shall not exceed $400. And whereas the proposed compensation is comparable to stipends per diem amounts established for other local commissions and Board of Health in neighboring counties, and whereas with the recent receipt of a grant that will offset general fund personnel costs, the approved Department of Health fiscal year 2026 budget has sufficient funds to support a monthly stipend to the Board of Health members that does not require any additional supplemental increase to the Department of Health fiscal year 2026 budget. And now therefore be resolved by the McHenry County Board that effective March 1st, 2026, Board of Health members receive a monthly stipend for each regularly scheduled Board of Health meeting attended as follows. Chairperson receives a monthly stipend of $140. Board of Health members receive a stipend of $100. Elected officials serving on the Board of Health do not receive compensation. Be it further resolved that the county clerk is hereby authorized to distribute a certified copy of this resolution to the county auditor, the chief financial officer, the county administrator, and public health administrator. This will be hopefully dated at Woodstock, Illinois on the 18th day of February in 2026.
No bad thing?
No way.
Sorry.
This, let's see. First, let's see if we can get the motion on the table. So then we'll have a conversation. John?
Make a motion to approve.
I'll second that.
Okay.
Do you want to explain the process too then?
Yeah, I will. A motion's been made by Mr. Markison, seconded by Ms. Holyfield, to approve and recommend to the county board to approve a resolution establishing remuneration and authorizing a monthly stipend for McHenry County Board of Health members. I believe most of you remember that this has been an ongoing goal or request for over 2 years. The state of Illinois passed the state statute at least before 2007. The last amendment to this section of the statute was 2007. And in my opinion, back then, whoever was the Board of Health, whoever was the county board, should have addressed this issue back then. And it should not be an issue coming before us at this point. I'm grateful that it has come up and we are pursuing it. It began with a conversation a couple of years ago between the Board of Health and County Administration on recognizing the sacrifices that our board members put to attend board meetings, to put the board meeting in front of personnel time, family time, sometimes having to schedule off work, and to recognize them with some compensation for their efforts. We tried to get it into the program for 2025, but there was a miscommunication between myself and county administration as to how that was to take place. And as a result, it did not get included in the budget. This year, in 2026, it was included in the budget request. And it went to Public Health and Community Service Committee, where it received support from the committee. It was my understanding that once it got the committee approval, that it was going to be included in the budget. That's my misunderstanding. When it went to the budget hearings, the budget hearing was more overall encompassing on many, many items, and it was a long debate that night with the county board members. And to pass the budget, this item was left off. It came to my attention at our November meeting that it did not get included in the budget, and so we began the process to have some discussions and some meetings with staff in the health department, and then with staff from the county to see what we could get accomplished. Well, as good fortune would have it for us, this grant that we just voted on came through. And what that has allowed is money that was incorporated in the budget to cover these expenses for vaccination programs is now going to be covered by a grant. So that portion of general fund money is available to go back into the general fund. Well, we're going to ask the board, county board, before you take all of that $25,000 back into the general fund, implement this program so that the Board of Health members are compensated for their time. It's a minimal compensation, but it's something. And
with the understanding that moving forward, this would be incorporated into the public health budget, 2027 moving forward.
Correct, correct. And once the board here approves it tonight, it will go to the Public Health and Community Services Committee for a presentation there, and then it goes to Finance and Audit Committee for a presentation there, which I have and Administrator Adamson have agreed to participate in and plea our case, if you will. And then it will eventually, hopefully, make it to the county board for the meeting in February for approval. So that's, is that pretty much covered? Okay. Any questions or comments from the board?
And I'll just throw one other thing in too. The Zoning Board of Appeals here in McHenry County is also given a stipend for attending their meetings. And they receive,
I don't know offhand.
it's more than what we have here in our resolution. That's all I can tell you. I can't remember. I think it's 125, and the chair receives 158. Right? What did they tell you?
I think it was 140 for the chair.
140 for the chair, and then maybe it's 125 for the members.
Yeah.
Thank you.
Are there any other committees or boards that get stipends?
Mental health board is prohibited. Let's be very clear. I want you all to know this. If anybody asks you, the mental health board is prohibited from receiving any type of compensation by statute. So that's the difference.
Correct.
Statute allows the Board of Health to receive, and it allows the zoning board to receive compensation, but not the mental health board.
Is there
Thank you.
a provided reason why they're not
There's a lot of verbiage in there about volunteerism. And they can be reimbursed for expenses
Yeah.
up to a certain level, but they cannot receive a stipend.
So do we fill out a W-2 then? Or?
So
You will.
just to clarify, so it will be based on attendance, so we'll have to provide attendance. I don't fully know exactly the process of how we get that information through the county, but it is taxable wages, so.
I will say that.
And you can always refuse it if you don't want it. Well, I mean, if you personally do not want to take those monies, you can absolutely refuse to receive them. But this would be something that you would be putting into place for now and moving forward for anyone who serves on the Board of Health. And I would just remind all of you, from my perspective, many of you have been or are currently licensed, and you have a huge responsibility across a lot of different topics, and we have experienced that over the past couple of years. So I just lay that on the table for all of you as well.
Plus, recently, the last couple of years, we took over the TV board responsibilities and duties. And so our role, our amount of material that we have to review and read and be prepared for at meetings is more than an average volunteer committee would be expected to do. And this is month in and month out. We have these packets that are very detailed contracts that we have to review and approve. We've had litigation going all the way up through the Supreme Court. We've had personnel issues, community, public sector hearings that we have to handle. It is quite a dedication for all of you members to come sit on this board.
We've had difficulty finding professionals that are required by statute to serve on the board.
If we don't receive it, do we have a say on where that money goes?
Or if we do receive it, are we able to put it towards things like donuts or E2E or other volunteer?
You can use it for whatever you want if you receive it.
It's your money.
I doubt whether you'd have the ability to direct where you want it to go if you don't
Besides your
take it. It would go back
checking
into
account.
the operating fund of public health. So from that perspective, you might have a say-so, right? It would be extra funds that would be within the budget, but, personally, my $100 I want to go to donuts. I don't.
You can't direct the county to do that on your behalf.
Right.
Kyle?
This is, as Joe mentioned, a topic that we've had for a few years now, and I just want to recognize Joe in his pursuit of this, which he does not for himself, but for everybody else. And I just want to lay on the table, I've expressed to him and to Pam, concerns that I have with this, because I feel very strongly that what we do here is to serve the public. And like many things that we do, we serve the public not because you're getting paid, but because it's the right thing to do and you feel the desire to serve. And I'm very mixed about this. In some ways, the money's not enough for what we do. It's certainly not enough. And like everything else in public health, the people that are here being paid to do public health, like our nurses and environmental health, everyone, they're not getting paid enough because they're serving, and we get the advantage of that. People who want to serve will serve for less money than they would command at a different place. So I weigh in my head all of this and the unfortunateness of it. And I will tell you that the one thing that has really swayed my opinion on this to where I will vote to approve it, or aye or yay, yes on this, is more what my wife asked me when I was going to these meetings, or during COVID, or when we were being sued, or any other things that come up. Like in the past in COVID, it was a very, very difficult time for us. And there was a lot of angst and anxiety. And she says, you're doing this to serve, yeah, but you're also got to pay for the babysitter. So at the end of the day, I'll vote yes, just so I can pay for a babysitter, so I can be here, so I can continue to serve. take that as you want.
And donuts.
And donuts.
Cupcake, we can upgrade to cupcakes.
Any further discussion or questions, comments? As this does have a monetary impact, I'll ask for a roll call vote.
And I would just ask that you make sure you put in the minutes that it's understood that if this does pass, that this will be incorporated into future budgets as we, thank you. Okay. You know me, anal.
It's great, thank you.
Mr. Markison?
Yes.
Ms. Hollyfield? Yes. Dr. McGuire?
Yes.
Ms. Lawson?
Yes.
Dr. Katz?
Yes.
Ms. Carmen?
Yes.
Ms. Gaffney?
Yes.
Dr. Hanser?
Yes.
Ms. Ortiz? Ms. Altough?
I promised that I would do this, and I said I'd go whichever way the board went, so yes. And I will be next to both Alyssa and Joe when we go in front of our committee meetings.
Mr. Clerk?
Yes. All voted in favor, motion carries. Next item is item 8B. Is an ordinance authorizing a solid waste removal finance agreement. It's a renewal contract.
If you're gonna read this, may I read it on your behalf?
Oh, wait, there is a resolution. Yes, you may.
All right. I want you to carry this all by yourself. That's the ordinance portion?
Yeah, that would be, yes.
All right, strap in. Ordinance authorizing a solid waste removal franchise agreement renewal. Whereas McHenry County has designated the exclusive collection of solid waste, recyclables, and yard waste as a way to increase services and lower costs in certain unincorporated areas on a 4-year franchise cycle effective May 1st, 2026 to April 30th, 2030. And whereas the authority for counties to designate solid waste collection services in unincorporated areas is provided for in 55 ILCS 55-1048, and whereas residents benefit from the comprehensive solid waste collection program, and whereas the designation of an exclusive collector for waste disposal services, recyclables, and yard waste has been successful in reducing overall waste disposal costs, improves recycling rates, improved air quality, reduced wear on streets, and provides a viable alternative to the open burning of yard waste. And whereas the county purchasing department and the solid waste manager developed a request for bid to provide waste collection services for residential households in the designated areas of unincorporated McHenry County for 4 years. And whereas 3 bids were submitted with Flood Brothers Disposal Company, Oakwood Terrace, Illinois, being determined to be the lowest responsible bid. And whereas participating residents will be billed directly by Flood Brothers Disposal Company, and there will be no county budget implications. And whereas the residents in the impacted areas have been notified of the county's proposal to start a new cycle for exclusive waste collection in their area, and have been given the opportunity to provide input through telephone, email, in person, or in written form. And whereas the Planning, Environment, and Development Committee of the County Board has received said input and has approved the exclusive collection of solid waste, recyclables, and yard waste for the residential households in the designated area of unincorporated McHenry County, detailed on the attached map to Flood Brothers Disposal Company. Now therefore be it ordained by this County Board of McHenry County, Illinois, that the chairman of the board is hereby authorized to direct the Assistant County Administrator to negotiate a franchise agreement with Flood Brothers Disposal Company to be the exclusive collector of solid waste, recyclables, and yard waste per the attached quote specification summary for the specific area of the attached map for a period of time from May 1st, 2026 through April 30th, 2030, with the resulting franchise agreement to be reviewed by the state's attorney and executed by the chairman of the board. And be it further ordained that this ordinance may be rescinded by the county board with a 30-day notice to Flood Brothers Disposal Company for non-performance of bid specifications. And be it further ordained that the county clerk is hereby authorized to distribute a certified copy of this ordinance to Flood Brothers Disposal Company, the Assistant County Administrator, Chief Financial Officer, the Public Health Administrator, and the County Administrator. Dated at Woodstock, Illinois, this 18th day of March, 2026.
The area that we're discussing is the Fox Lake Vista area. That is the neighborhood that this ordinance covers. Would someone care to make a motion
I'll make a motion to approve the ordinance authorizing solid waste removal franchise agreement renewal.
Second?
Second.
Okay, we have a motion made by Mr. Markison, second by Ms. Gaffney, to approve the ordinance authorizing a solid waste removal franchise agreement renewal. The comments, questions from the board?
What underlies this?
The state of Columbia comment?
Are you asking, Dr. Hansel, are you asking how we got started doing solid waste franchising?
How come we're changing our solid waste?
The agreement? So it's done
Don't
on
we currently have a solid
Yes.
waste?
Yes, we do. We have one in this area, but they're done on a 4-year cycle. So it will expire at the end of April. So we are just renewing the contract and we have to repeat the bid process. And this time it will be Flood Brothers Disposal Company as the lowest bid.
There's agreements in different areas, unincorporated areas of the county. There's multiple agreements.
Yeah,
And this,
like my house.
right, mine too. This one is particular to this Fox Lake Vista neighborhood. Anybody else?
And I'm just wondering, they have a better price? Do they have better landfill? What is it?
For Flood Brothers or why we're doing the franchise agreement?
Yeah, for flood.
For Flood Brothers, right, so we created a specification sheet of all the services that we wanted incorporated into the agreement. And we had 3 companies that bid on it and they provided the lowest quarterly cost to provide all of those services. So there's leaf vacuuming, there's landscape waste pickup for a great part of the year. They can put out a large bulk item once a week. And they get, toters and recycling bins, et cetera. So it's very comprehensive.
I've reviewed that, and it is really good. They give a lot of service for it. I was curious, there must be a ton of these areas, and maybe they're just historically that size. Was there any thought about, or future, do we look at combining them or getting additional cost efficiencies by negotiating larger areas, or how does that work?
Yeah, yes, exactly. So this one is actually reduced in size because it also historically included the Crystal Lake Manor subdivision. However, they're in Algonquin Township and our solid waste manager worked with Algonquin Township. They went to vote and they now have their own township-wide franchise agreement. So Nunda Township also did the same. So there are large areas that actually have done it. After we had, put our first ones into place, which is really a very positive thing for everybody. So our Crystal Lake Manor residents will now be going into the Algonquin agreement since ours has expired. That's why this one's smaller. We have one other one, it's the larger one from unincorporated McHenry Township. That's about 7,000 residences. So this one's small comparatively, but that's why.
Thank you. The agreements, they don't cover small dumpsters, like 2-yard dumpsters?
No, the company does have to provide dumpsters, but that's something we had to work through on the first cycle through is because there are specialty businesses and things that do provide dumpsters, right? So they can get a dumpster through Flood Brothers if they choose to, and some do choose to do that. Agricultural properties, et cetera, sometimes do. But then we also have others, for instance, if you're a roofer and you provide a dumpster for it, you can bring in your own company that does it. It will not necessarily be Flood Brothers. So it's specific to residential removal of municipal solid waste on a weekly basis. Does that make sense?
Right.
Okay.
But for farms that use a couple of yard dumpsters, there's no regulation, there's no competitive bid.
That's correct.
On the trash removal company,
That's
so they can set their own price then.
Yes, that's correct, and the reason is that farm properties, agricultural properties are considered are not considered residential. And so therefore, you're outside of that and you can go to any vendor that you would like to. That'd be true of any properties that met that same criteria, even if they're just in this area of the agreement.
Gotcha. Okay, no further questions. Well, this doesn't have a financial impact on us. It does have a financial impact on the public. So I'm going to have a roll call vote.
Mr. Markison?
Yes.
Gaffney?
Yes.
Dr. Answer?
Yes.
Ms. Carmen?
Yes.
Ms. McGuire?
Yes.
Ms. Holloway?
Yes.
Dr. Prince?
Yes.
Ms. Altough?
Yes.
Ms. Lawson?
Yes.
Ms. Ortiz?
Yes.
Mr. Clark?
Yes, all voted in favor, motion passed. Next item on the agenda, any board member have any issues that they wish to discuss? Next item is item 10, information and communications. There is quite a packet of reports and statistics. I encourage all board members to give it a look over so you have a good understanding of what our department is accomplishing. Item 12 is executive session.
I'll make a motion.
A second.
Make a motion to go to executive session for 5 ILCS 120/2 C11 pending litigation and C1 personnel.
I'll second that motion.
Pam?
Yeah, sorry.
Sorry. The motion has been made by Mr. Markison, seconded by Ms. Altough, to enter into executive session to discuss items covered under Chapter 5 of the Illinois Compiled Statutes, Act 20, Section 2, Paragraph C, Item 11, pending litigation. Same chapter of the Compiled Statutes, Act 120, Section 2, Paragraph C, Item 1, personnel. All those in favor say aye.
Aye.
Those opposed say nay. We are entering executive session. Motion passed.
Thank you all.
This is where I can use it. I'm just gonna say.
Scott's staying with us.
If you'd like Girl Scout cookies.